girl gang, it's Dr. Joy here, and you are watching Delivering Joy MD. So we are talking about abnormal periods in this series, and today I really want to hit up abnormal periods for my younger women because when women start their periods, that is usually the best time to find out if we're going to have a problem with really heavy bleeding. So today's video is going to focus on heavy bleeding in young women. Make sure you keep watching. So in terms of heavy bleeding, we want to think about what's called hemostasis. And hemostasis is just a fancy way of saying how we stop ourselves from bleeding. And that could be from an injury, from a menstrual cycle, from surgery or dental work. So hemostasis is basically how we keep ourselves from losing all our blood whenever there's an injury to any part of our body. So in terms of thinking about the menstrual cycle, we want to go back to the basics. So if you've been following my videos, you know how the menstrual cycle works. And I'll link that video in the description box below so that you can catch up if you haven't seen it yet. But basically, we know that our period comes from the inside lining of the uterus. And every month, that inside lining of the uterus is getting thick and it's becoming full of these blood vessels called spiral arteries. Those spiral arteries are there in the event that a woman becomes pregnant and the pregnancy has to actually bury itself in that soft lining and connect to the mom's blood supply. So those spiral arteries are there really to help sustain a pregnancy if it should happen. Well, if you don't get pregnant and you have your period, that lining on the inside of your uterus actually sloughs off, it comes off. And so it exposes those spiral arteries so that there's no skin covering them. And then that sloughing off of the lining actually starts the period. So it is a mixture of tissue and blood that comes out during the cycle. So that endometrial tissue and some of the blood from those spiral arteries come out. We have to have a way of stopping those spiral arteries from bleeding, or we would lose way more than we should be losing. So if you caught our first video in this series, you'll recall that I pulled out my measuring cups and that we actually looked at 80 milliliters or 1/3 of a cup. And that is the average amount of blood that should be lost during a 3 to 7 day period. So many women are losing more than this and just don't know that it's not normal. And so we want to make sure that everybody has this information. So in terms of our younger women, really thinking, our preteens and teenagers, we really have a few different causes. And the most common cause for heavy blood flow during menstrual cycle in younger women is actually abnormal hemostasis, or inability to stop ourselves from bleeding during our menstrual cycle. There are two ways that the human body stops bleeding. One is these tiny little pieces of our blood called platelets that flow to the area where the bleeding is occurring, and they kind of like plug it up. And then the second thing that happens is these proteins called clotting factors come in and kind of like really secure that platelet plug until whatever injury in our body can be healed. So the same thing is true for the lining of the uterus where those spiral arteries are. So when there's damage to those spiral arteries as the lining of the uterus sheds off and we have our period, the platelets run there and they try to plug up those arteries, and then the clotting factors come and secure that platelet plug. And so that's why sometimes we see clots during our cycle, especially if we're bleeding heavily, is that our platelets and our clotting factors are trying to fight for us. It's just kind of an overview of how we are thinking about clotting our blood during menstrual flow. Ways to recognize that you may have a problem clotting your blood. This is usually something that's diagnosed when young women first start their periods and they have really heavy blood flow from the start. Sometimes younger women may go to the dentist to have their teeth cleaned or to have a tooth pulled and have really excessive bleeding beyond what is considered normal. Women who are having nosebleeds more than 1 to 2 times a month, women who get these big bruises that they don't really remember getting, and they're getting those 1 to 2 times a month. These are all signs that our clotting may not be working just right, that we may not be able to clot our blood the way we should. And of course, if you have a family history of free bleeding, which is what we call it here in the South, that is certainly something that we want to look out for in our preteens and teenagers. In terms of thinking about overall body function, a very common cause of abnormal clotting factors is actually what's called von Willebrand's disease. And von Willebrand's disease is the most common cause of clotting disorder in younger women and in women in general. And it is diagnosed by a blood test. And we can actually treat this with hormonal birth control. So you can actually use birth control to treat this. With von Willebrand's disease, you have a problem with the function of the platelets that are going to plug those spiral arteries on the inside lining of the uterus. And then you also have a decreased amount of one of the clotting factors that comes to shore up that platelet plug. So von Willebrand's disease can be pretty common, and we often diagnose it in younger women who are just starting their period. Thyroid disease can also be another cause of really heavy bleeding. Usually hypo or low thyroid hormone can also contribute to that. So if a younger woman is having really abnormal bleeding, really a woman of any age with abnormal bleeding should definitely be tested for thyroid disease. And the most common causes for women ages 13 to 18 who are having heavy bleeding are going to be your clotting disorders. Women can have abnormal ovulation when they first start their periods, and so you may see really just sporadic, erratic bleeding. Hormonal birth control can also contribute to women having irregular or heavy bleeding during their teen and young adult years. Pelvic infection is another thing that we should consider, especially if a young woman is sexually active. 1 in 5 women who has really heavy periods actually has a clotting disorder. So their hemostasis is affected. It's so much better for young women if we catch this early. So if you're a mom or if you're a young woman and you are noticing that your daughter or that you are having really heavy bleeding during your periods, it's something to speak up about, because we should do this testing. It's very easy to treat with something as simple as a birth control pill or with a nasal spray called desmopressin that can also be given IV. And if we know that you have a clotting disorder, then we're able to really control and prepare for that whenever you have to have any sort of procedures and even around your periods. And so birth control pills is usually how we control heavy bleeding from a clotting disorder in younger women who are diagnosed with von Willebrand's disease. So I hope that this information has been helpful for abnormal bleeding in younger women. Even if you are way beyond your teenage or young adult years like me, you could still have a clotting disorder that just has been undiagnosed because no one's ever looked for it. So it can certainly be a cause of menorrhagia or really heavy periods. So make sure that you are aware of this and that you share this information with your girlfriends. If this video was helpful, give it a thumbs up. Make sure that you like, share, and subscribe. We'll be back next time when we'll be talking about abnormal bleeding caused by polyps. All right, girl gang, peace.